Hello, I am Dr. Bapuji again. I am the chairman of Center for Integrated Medicine, Hyderabad. Integration means I am qualified in allopathy, naturopathy and yoga. For the last 45 years I have been practicing integrated medicine. Today I have come before you to talk about common problem across the world, sciatica. Ask anybody, he has got sciatica. Which leg? Right leg. Some people have right leg, some people have left leg, some people have both legs. They can't stand 10 minutes. They cannot sit in the chair for long. The leg starts pulling. Some people have tingling and numbness. Now, sciatica is not a diagnosis. Remember this. Sciatica is a symptom where the pain comes from hip down to the foot. Like jaundice, we say. Jaundice, yellowish discoloration of the eyes. Jaundice is not diagnosis. There are number of diseases that can cause jaundice. Similarly, sciatica is only a symptom. It is not a diagnosis or a medical or orthopedic condition. So sciatica can occur. Commonest cause is lumbar spondylosis. Okay, the aging process of spine. Now, according to one estimate, 8 out of 10 people are suffering from either lower back or neck problem. 8 out of 10. America is losing $120 billion annually towards lower back or neck or both. Annually. This is the age, worldwide incidence. But in my clinic, I am seeing 15-year-old kid is having sciatica due to lower back stiffness. And when I got the MRI done, there are already changes in the discs. So, spondylosis is a normal aging process of the spine. Now, I was taught that these aging changes usually occur after the age of 40. 45 years ago I was taught. Now it has been reduced to 30 years. Now in my clinic I am seeing 17-year-old girl who is doing her BTech, she has got a severe sciatica. And the kid, 15-year-old kid, during the lockdown, 3 years, he has not gone to the school, he has gained weight, and all the time he sits with his smartphone and then whole day he spends no physical activity. So reasons I will describe later. So sciatica is the pain which runs down. It can be due to spondylosis. Spondylitis word has been discontinued because it is not inflammation. So spondylosis, and it can be due to fracture of the spine. It can be due to TB in the spine. It can be due to cancer in the spine from elsewhere sitting. And there is one condition known as there is piriformis muscle across the hip because sciatic nerve passes down through under that muscle, and if some people have got the habit of putting purse in the back pocket, and that purse is so thick with coins, cards, visiting cards and notes, that is enough to cause pressure. Instead of calling, we call it as piriformis syndrome. So don't put thick purse in the back pocket. That is also one of the precipitating causes for sciatica. Now, what is the treatment for it? Now, people go to immediately orthopedician. Orthopedician initially writes a painkiller. He gets the X-ray done, and the X-ray doesn't show any serious problem like slip disc, reduction of the space between the vertebra. And some orthopedicians immediately say there is nothing significant here, get an MRI done. MRI is a high resolution picture, and when he sees down somewhere the disc is black and dried up, or in some people disc comes out a little. Now, multiple disc prolapse also is known as spondylosis. Even today it holds good, but after MRI has come, slip disc, slip disc, slip disc. Everybody says, I have got L4, L5, I have got L5, S1, disc prolapse. They don't understand what it is, but what doctor has said, they say. And the report also, they write it is causing pressure on the nerve root and so on. And neurosurgeon is also involved, neurophysician is involved. Ultimately, they collectively take a decision saying that you require a surgery. Now, because people are scared about the surgery, and they either discontinue that doctor, go for second opinion, third opinion. Out of 3 people, one fellow says no surgery needed, 2 people say surgery. When they go for fourth opinion, he also says no surgery. Whom should he follow? So sciatica basically is because of stiffness of lower back, commonest cause. There may not be any changes in the spine and patient may have lower backache and severe sciatica. Now I have seen MRIs here, disc prolapse is on the left side, patient has got right sciatica. So MRI is not the criteria to decide about surgery. One gross thing you all should remember, even if there is severe sciatica, if you are able to stand on toes, lift your heels equally, take the support of the wall and check. If you are able to lift your heels, then stand on heels, lift up your feet in the front. If equally they are able to do it, it's not a case for surgery, has been taught to me by a senior most orthopedician, and even today senior most orthopedician, they are conservative in approach because lower back surgery has got lot of risks, causing paralysis, no control on the urine and no control on the motion. The anal sphincter becomes tight, motion doesn't come out, people have to remove with the finger. So lower back surgery, one should not take a hurried decision. So as far as the TB is concerned, malignancy or cancer from elsewhere sitting in the spine is concerned, you don't have to worry because X-ray can show it, MRI also can show it. Then osteoporosis. Now what is happening is when people go to orthopedician, not only he writes a painkiller, he also writes calcium and D3. 60,000 K once in a week. Calcium. If you take excess calcium, then what happens? Body will absorb only what it needs. And by chance, if it is excess goes into the blood, it may cause kidney stone, ureteric stone. So calcium is only needed, D3 is needed by people who have got number of deliveries, number of children she has breastfed. Such people have calcium decrease in the blood, and only such people require. So when they take calcium, what happens is pain should come down, isn't it? Some patients have been prescribed only calcium and D3. Some multivitamins, methylcobalamin, B1, all these multivitamin and with minerals and all that are prescribed. Then if that is the diagnosis, then it should come down, isn't it? The only thing is in sciatica, there is nothing to worry. You have to make your lower back flexible enough. For that, you have to do spinal exercises. Stop all other exercises, including walking. Use thin mattress. Use sufficiently thick pillow so that neck is horizontal. And if you make these changes and if you do spinal exercises, you will start feeling much better in a week's time. You can take some analgesic which do not have much side effect. In Western countries, they give Tylenol or even Advil you can take for 1 or 2 days or 3 days when you start doing exercises. And in India, we give paracetamol, Calpol we call it. Dolo has become very popular during Corona time, and a muscle relaxant. In my opinion, Valium is the best muscle relaxant, centrally acting skeletal muscle relaxant. In a case of status epilepticus, that is continuous fits, Valium is the only thing which saves the patient, because continuous fits is status epilepticus, which is a medical emergency. So I have been using diazepam or Valium 2 mg, 5 mg, 10 mg. Maximum I use 10 mg at bedtime, and T-spinal exercises bring in changes in mattress and pillow. Patients settle down in 10-15 days. Thank you.